New York and on the new Hot 97 app. Ebro in the morning on Hot 97.
Ladies and gentlemen, Ebro in the morning, Laura Stiles, Rosenberg. We have a guest today so we could delve into deeper what's going on in the black community with where this COVID-19 is hitting us very hard. We have Dr. Bernard Ashby. Doctor, you are a cardiologist as well as a health policy expert.
Yes, sir. Nice to be here. Thanks for having me.
No problem. I would love for you to talk about what we are learning about Chicago, New York, Louisiana, Michigan, even Milwaukee, and how black people are overwhelmingly suffering from this COVID-19 epidemic. Why is that the case?
Well, you know, the issue here is that it's not a big surprise, and anybody with any experience with the U.S. healthcare system can see this coming a mile away. So if you know what the risk factors are, first of all, for COVID-19, at least the risk factors for doing poorly, you will understand that these are things that are disproportionately prevalent in the black and brown community. So things like diabetes, high blood pressure, obesity, asthma. I mean, who that sound like?
That's
I mean,
us.
that sounds like, yeah, it sounds like us. It sounds like your aunt, your brother, yourself. I mean, it sounds like a lot of people you know. And
hell, sounds like me. I grew up with asthma, but because I changed my diet and I changed the way, you know, I haven't experienced those issues, but I have a predisposition for, you know, diabetes in my blood. Even when I go get a physical now, the doctor's like, what is it, the LDL cholesterol or something like that?
Yeah. Your A1C is what looks for your sugar levels or your glucose levels, and then your LDL is your cholesterol levels.
Right, and so they look at my LDL cholesterol levels all the time, which are high, even though I don't eat animal products Monday through Friday usually. And, you know, I take my vitamins and exercise and do all these things, but my levels are still higher than normal.
We need to talk offline, my man. You know, definitely. It's one of those, you know, heart disease is the number one killer of all Americans, but definitely black and brown women and men. And the majority of it, 80%, is preventable.
Right.
And it just requires lifestyle, which is something that you're pursuing. But in addition to that, it requires good care, man. Straight up.
And so now we're having this awakening for some.
Yeah.
But as you noted, this is something that people have talked about for a while. But because of economics and racism in America, this has not been addressed.
Yes. Yo, so thanks for bringing that up, man. I really feel like we're having another Katrina moment right now as we speak, like a slow motion Katrina. Because at the end of the day, we knew that COVID was coming, right? And I like to describe it as a hurricane. You know, it's like a hurricane's coming. What do you do when a hurricane comes? You board the windows, you put up the sandbags and you evacuate. But we did none of that. And now that we're in the eye of the hurricane, we're sitting here still like wondering what to do. And just like Katrina, our government has not mobilized to protect our communities while they're dying at an extraordinarily, disproportionate rate.
Well, they haven't mobilized to protect really anybody unless that community already is affluent. There, you know, which is why New York City is getting hit so hard. People now, if you don't live here, understand the level of poverty and the economic disparities in New York City, because now you're seeing areas literally 2 miles from Manhattan that are mostly black and brown that are suffering the most.
Ebro, listen, man, you talking about things that we know, we talk about daily, and I'm tired of talking, right? So basically, my purpose on this station is I have an agenda, right? Like one of the things that we need to do is protect ourselves. I call it the village mentality. And one of the things that I'm asking people to do is just wear your mask. A lot of people don't understand how effective wearing masks are for reducing the spread of the COVID-19, the virus that causes the COVID-19 disease, basically, okay? And really, when you wear a mask, it's to prevent you from spreading the disease to someone else. Because a lot of people, when you get it, initially you're asymptomatic, or you may never develop symptoms.
Right.
Dr. Fauci mentioned that up to half of the people that get the virus don't develop any significant symptoms. So, you could be spreading the virus and not even know it. And if you're wearing a mask, it prevents you from spreading the virus unbeknownst to you. So wearing a mask is something that they do in all the other countries that have been affected by viruses in the past. So if you look at, China, Japan, other countries that have been affected by the SARS or MERS or H1N1, they wear masks routinely, and it's because they understand that you to decrease the virus spread, you have to wear a mask. In addition to isolating, which we're already doing, but it's tough to isolate when you live in multi-generational homes. It's tough to isolate when you're an essential employee. You work at a grocery store, you work in a correctional facility, or you're a bus driver. It's just hard to do that, right? So if you have to be out and about, which a lot of blacks and browns are, wearing a mask is extremely critical to protect themselves, but also the public needs to protect our essential workers. If you go to the grocery store, wearing a mask protects that grocery store, that clerk at the counter. So
now you're down in Miami.
Yes, sir.
And how here when I'm yesterday I drove to drop my daughter. Her aunt's on quarantine, her mom's on quarantine, and I drove and dropped my daughter at my aunt's crib for a little while. Her aunt's crib for a little while. Every car I see driving, everyone's wearing a mask on their face. If it's New York City, so there's still people walking. I see a lot of people wearing masks. Are you guys seeing that in Miami also?
Not really, not to the same extent. And it's really because of, New York got hit a lot harder than the rest of the country.
Got it.
New York got hit ridiculously hard. New York got hit harder than the rest of the world, period.
Right.
Yeah, we're the worst now.
Yeah, so New York as a state has more infections than but any other country in the world, more than China, more than Iran, more than Italy, more than all of those countries, more than China and Iran combined. But you have to take those numbers with a grain of salt. But the point is, New York is ridiculously disproportionately affected by the virus, which actually predominantly came from Europe.
Doctor, real quick, if people don't have a mask like you have right now, can you give them some other options that are also effective to prevent the spreading of the disease?
Definitely. I encourage everybody to check out cdc.gov. It has some great tutorials, videos, some exhibits that show you how to make your own mask. Basically, you need cloth, 2 layers of cloth, and you could wrap it up and do it any kind of way, and you can be very creative. And basically, what I want to do using your platform is to create the Mask On Challenge. Our community is incredibly creative. The hip hop community is incredibly creative, and I want to make this a wave, basically. So, at your crib, make a dope mask and rock it, and see if you can challenge other people to make their own masks that meet the specifications laid out by the CDC.
Hashtag mask on.
Yes, sir.
Doctor, have you seen those demonstrations when people are wearing a mask and they have like a lighter and they attempt to blow it out? Like if you can blow it out, it's not effective. If you can't, then it is. Is that true?
Yeah, I mean, to an extent. One of the things that you can, first of all, I want to explain that I'm not a mask expert. Okay. I'm a cardiologist, healthcare professional, and we've been forced to become experts in SARS, COVID-2 because of what happened. But yes, there is some evidence that if you can't really blow through the mask, that is one way of determining whether or not that mask is effective. So yes, that is the poor man's way to determine if your mask is actually protecting other people, and I want to emphasize that. All right. And then the other thing is, I want to touch my mask right now, but before I touch my mask, you want to make sure your hands are clean. And one of the reasons why masks do not work is because we're always touching our face. And the other thing that I want to emphasize is clean hands. You have to be almost OCD about it.
I would like to get into health care specific to the heart and heart disease.
Yes.
I'm not sure if people like yourself are into natural medicines and as well as, vitamins not vitamins, but herbal solutions, diet. I'm not quite sure where people that are cardiologists have opinions on that. But me personally, most of the information that I've been able to access says that, fatty meats, as well as, just things with bad, that deliver bad cholesterol to the body, processed sugar, processed meat, these things are damaging people's hearts and
So,
creating an
yeah.
atmosphere for this to become a bigger problem.
Listen, man, the diet is extremely important. And I'll be the first to admit it that doctors, especially in the United States, don't talk enough about lifestyle. And you mentioned sugars, processed food. That's really the thing that's killing a lot of people here in the U.S. Bread, rice, pasta, cookies, soda, juice, all of that stuff is increasing, obesity, diabetes, and heart disease. The meats, they're not ideal, especially the fatty meats. But I would like to just kind of point out that processed food is actually killing a lot more people. And in terms of this being, lifestyle, moving your body is extremely important. If you can move up to a mile a day, that's extremely important, especially during this lockdown. As long as you're practicing social distancing, so 6 feet minimum, and watching what you eat. But less processed food. But that's a hard thing to ask when people are just trying to struggle to eat. So I like to just try to focus on things that people can actually do, which is move your body and just try to make better choices. Drink more water. Try to avoid carbs if at all possible.
Oh, you say that you're a health policy expert.
Yes.
What information do you have for people on the government level and the policy level that you think may change after this COVID-19? I mean, look, it's still going to require people to vote. It's still going to require people to be active in their local community. It's still going to require people to take action unto themselves and take responsibility unto themselves, right? The government's not going to swoop down and fix problems. I'm not a believer in that. It's going to require people to engage. But what policy do you see happening after this?
Listen, man, Bernie started a movement. And I think it's up to us to continue it, especially I like to call it the hip hop block. I mean, like there's a whole block of people from Generation X down to Generation Z that listen to hip hop. And we need to coalesce and actually advocate for our own interests. And as you can see, something like this, kind of just puts it out there. And yeah, you need to go out and vote, but more than vote, you need to hold these politicians accountable. Because a lot of things the Democratic Party does, they don't look out for our interests. They take our vote for granted. And so you got to hold them accountable and tell them straight up, I want to curse right now, but let me calm down. But you got to look out for us, man. You cannot take our votes for granted. So in terms of specifics, we need more access to healthcare. And even more specifically in terms of what's going on right now, because I like to say that this is a hurricane. Right now, we're in the eye of the Hurricane Katrina, COVID-19. And we need things like access to PPE for people who are vulnerable, personal protective equipment. So people in vulnerable communities, they need access to masks and even N95s if they're vulnerable. Other things that we need right now is access to testing. Those communities that are being disproportionately impacted, we need testing ASAP. Okay, we need to set up testing centers. Everybody in that area needs to be tested. Why? Because anything short of a vaccine, you need to be able to determine who has the infection. It's kind of like having X-ray vision. And so if you could test everybody in that community, who has it, who doesn't, and then you could avoid the infection and actually do contact tracing, meaning that people who are exposed to individuals who tested positive can then undergo self-quarantine and prevent them from further spreading the virus. But there's a bunch of other things. But at the end of the day, we need to focus on our communities. And our government right now is actually failing us. And we need to have the village mentality and do things like they do in other countries, like, supporting vulnerable populations. And I want to, really encourage everybody to look out for their neighbors, man, because, all we got is us right now.
Dr. Bernard Ashby, cardiologist, thank you for your time, man, and thank you for the words today. Your message is something that, obviously we're hearing a lot of places.
Yes,
and
sir.
we're also trying to communicate here on our show every day. But this isn't one of those messages that you get to say one time and people get it.
Nah. Yeah, we gotta hit the waves, man. Y'all have a very powerful platform right now, and one of the things that I'm proud of is a lot of people like me are doctors and professionals now. Now it's our time to make a change, okay? Because we're under attack right now from the COVID-19 pandemic. We're at war right now, and we need to squad up. And one of the things that I want to encourage y'all to do is wear your mask.
Yes.
Because you guys are influencers. And so wearing your mask, even on air, tells people that it normalizes it because a lot of people are not watching CNN. They're not watching these popular news outlets. They're listening to y'all.
Yo, Griff,
I
bring my
definitely wanna encourage
N95s, man.
Oh my God.
Yeah. What you said?
We got N95s here at the station.
right.
We've been had on stash. Rosenberg,
Yeah.
how many you got at home? You got 2 still?
I'm giving them away today. Actually, I was going to give them to the hospital.
The 2 that you have.
I have like 4 or 5.
I have
Okay.
regular surgical masks at home too.
Yeah. At least with a surgical mask, but y'all swag out some nice homemade masks. I want
Yep.
y'all to be part of the mask on challenge.
Keep the bandana,
Absolutely.
You know what I'm saying?
I have some good homemade ones coming.
Mask on.
All right, man. Y'all rock them things and let the community know because New York, they know because, every day you see the people dying there, but the rest of the country hasn't hit yet. And I don't want that to happen. So we got to encourage people to stay home and rock their masks and clean their hands, man.
My joint is
Straight
fire too. Swagged out.
Yeah,
You
what?
know what I mean?
Oh Lord.
Got my bandana on.
You don't sound great.
Yo, let's go, man.
Hey, Ebro, I want to point out something that I discussed with my fam last night. And this kind of points to structural inequality, structural racism. One of the things that my peoples is worried about, my man DeMarco from Philly, he said, you know what? If you encourage people to wear masks, they might get shot, bro. Like, people get scared when they see your brother wearing a mask.
That's a fact.
And that's an example of structural racism, dog.
Of
Yep.
course.
Do you understand? Like that's something that I would not consider for my patients living in other communities. But that's something I got to consider for a black and brown boy living in New York City, Philly.
Well, and also
Baltimore.
that's why I got this bandana on right now. But
Yeah.
that's why when you spoke about PPE earlier, it makes it more of an official item, right?
Yes.
Like an N95 or a surgical mask. It doesn't look like just a bandana over somebody's face.
Hey, listen, man. My cousin, he got tests on his face, and he was wearing an N95, a surgical one, the same one that we're in the hospital. He said when he walked into the bank that they acted like homie was about to rob the place.
Yeah.
Well, they probably was gonna act like that anyway, without the
that's
mask.
a big fact. But what I'm saying is that that's just an example of what we got to deal with, and it's unfortunate, man. But
Well, and like we started the
Yeah.
conversation, and this is key. These
Yeah.
problems have always been here.
yes,
And just like with Katrina, or even when we was dealing with drug abuse and
Yes.
the crack eras, those problems disproportionately affect us and people
Yes.
who look like us and our family members. And that's always been there. But we continue because it's either the only option or the best option
yeah.
to operate in a space, and the space I'm talking about is America, where everything's all good and we gonna figure it out. And unfortunately, operating in that mindset and opting into this American bullshit marketing system has ultimately ended us up with a lot of fast food in our communities, a lot of dependency issues and trauma which came from slavery and other things, and now we're here.
Yep.
And so we're dying at a higher clip, and we got to take matters into our own hands and not sit around and act like the government is going to swoop down and save poor people. There is no precedence for that happening.
Yep. Nah, listen, man, you hit the nail on the head. That ain't gonna change overnight. And right now, in the eye of the storm, all we got is us.
And if you're not ready, if your household is not ready to start talking about how our cultural foods are the killers, about how that fried chicken that you line up for multiple times a week is the killer,
Yeah.
right? Then we not ready. You're not ready to live.
Yes, sir. Yeah. I mean, our lifestyle is extremely important, man. And there's a lot of issues. There's a lot of layers, man. There's a lot of layers, especially when you live in paycheck to paycheck.
Yeah.
And when you have a lot of kids, in your home, you have a lot of dependents. A lot of people aren't paying attention to their health, man. They just get whatever's accessible, and that is a structural issue that we need to get to the bottom of, man. And talking about it in these platforms is extremely important, but we need real structural change, and that starts with us really, looking out for our own special interests and that voting. But even during this pandemic, man, we need to figure out how we could prevent this virus from spreading through our community and disproportionately further killing our brothers, sisters, cousins, aunties, uncles, aunts. Because right now we are in the midst of a pandemic, and we need to mobilize and protect ourselves right now.
Dr. Bernard Ashby, thank you for your time today.
Thanks, Doc.
Thank you so much. I appreciate you having me on. And if you want to check me out, I'm at BAshbyMD on Instagram. I give a lot of updates, so definitely check me out. Information is power, and I want to empower the people.
BAshbyMD. Thank you, man.
Thanks, Doctor.